Hi everyone, this is Ketel here at INSEAD. I'm joined by Anthony Renshaw. Hi Anthony.
Hello.
Anthony is INSEAD alum, Gemba 2014, and he's a medical director at International SOS. He's based in London, and the organization he's working with is providing medical and travel security services to employees of large corporations. So Anthony, I'm going to be asking you 3 questions. And the first one is, how does your job at International SOS relate to the current COVID-19 pandemic?
Well, one of my roles as a medical director is to provide guidance on global health issues to organizations. And do we have a global health issue right now? So since the start of January, really, we've been tracking this very closely. And I've been working with multiple companies to help them make the right decisions during this outbreak and now pandemic.
And from that viewpoint, having that overall perspective at how international organizations and corporations are reacting, what would you say is their main role in terms of the response to the pandemic?
I think there are 3 main areas that we're advising companies to focus on. The first is providing information and guidance to their employees and to their communities. And I think business has a massive role to play in that. There will be some countries that businesses are operating in where the employer is essentially the only voice of health communication to those workers. So ensuring that the workers get access to medically verified information sources is key, be that through the WHO, through local public health authorities, the CDC, or through International SOS. I think businesses have a massive role to play in that. The second is in the provision of support to travelers. And this is a key group of individuals that needs support now more than they ever have in any other crisis we've dealt with in the last few years. So giving them access to support, assistance, evacuation, whatever it is really key right now. And the third area is looking at business continuity with a public health lens. And I think there is a tremendous role for businesses to participate in this fight against COVID by making sure that their planning includes specific reference to public health issues. What does isolation mean? What does quarantine mean? Can we help contact trace in certain circumstances where countries might not be doing that? How do we manage a case in the workplace? All of these things are really important right now. And I think a lot of businesses are starting to put a lot of work into that. So they've got robust plans in place for the next outbreak, because this is not going to be the last one. This is certainly the biggest that we faced, but as we see shifts in the way disease is popping up around the world, we can expect more outbreaks of different types. So the work that is done now will be of benefit in the future. And I think that's a key message that we'd like to give to businesses. Don't make that effort be wasted. Make sure that those processes and learnings can be applied to other outbreaks.
Thank you, Anthony. And what we are seeing as well is that most of the response now is very localized. And in that sense, there is a particular vulnerability of local and smaller business, as well as an opportunity for them to play a key role in the response. So same question here in terms of smaller localized business. What's the key role in this context?
Well, I think smaller businesses in particular are more exposed in many ways. And so I think it's particularly important for them to maintain perspective, make sure that the information they gather is sound. I think there are two types of business owners. There's the ones that roll with it and accept the uncertainty, and there are those that find that very difficult. And the second group, I think, is a challenging group. So there's certain things that every business owner can do. Listen to public health. Don't demand access to testing when that might not be available. Think of the broader community. Don't demand that healthcare workers see you when there is no indication to do that. And I think any business owner can play a part by being an emissary, let's say, in their community, to provide balanced communications, to help their employees, to help their local communities in whatever way. And we've seen some really great examples of simple things that business owners can do. For example, opening stores at different times for the elderly, or making it just easier for people to get supplies. So there are small things that I think every business owner can do. But there's a few, I guess, learnings that it would be great to share with you. Many businesses are trying to play their role by sending supplies from one country to another country without necessarily considering what impact that might have on their own country down the line. So please don't rob Peter to pay Paul. Make sure that all of these good efforts and good works are done based on science. Is there a real need? There'll be other small businesses as well that can contribute by manufacturing different products that might be of use to the health system and the like. And we're seeing a lot of examples of that. But I think the main contribution that all businesses can have is to protect the duty of care of their workers, and to ensure that the communications we put out are pragmatic, are put into perspective, and are medically guided rather than guided necessarily by emotion, which I think is really what we're seeing quite a lot of at the moment.
Well, Anthony, thank you very much for joining us and for answering these 3 questions.